one can estimate that today, if unemployment goes up by 1%, we're looking at somewhere in the neighborhood of 58,000 additional deaths from what are called deaths of despair.
Wow.
And we're not talking about 1% unemployment increase right now. We're talking, I mean, what the New York Times said this morning is the highest 1 week unemployment figures since they began recording these numbers in the United States. So the numbers are going to be much higher than that. So the Imperial College London model that has been driving this conversation for the last 2 weeks completely ignored deaths of despair. All they cared about was the virus. They didn't model anything we could do to try to stop the virus. It was all doom and gloom. And they never bothered to consult 50 years worth of research that shows that when unemployment goes up, lots of people die. That's the issue. And the way it's been presented in the mainstream media is maddening, because it's presented as if Trump is just trying to protect the stock market. That's not the right way to think about it.
And I have to be honest, it's been really obnoxious, I have to say, to watch doctors parading out and news reporters and news anchors all telling people, you know, this is, you know, stay home, watch Netflix. Donald Trump's going to put everyone at risk. He's going to get people killed. What you should do is just do your part, and that means just stay at home, watch Netflix for the next few months while we handle this. While we, the news anchors who will not lose one single day of work, who will not be laid off, while we, the medical establishment, the doctors and the pharmacists and the people that make respiratory, you know, products, that while we increase our revenue and get more hours and get overtime in probably, you should do your part, and we're going to tell you what to do while we continue to hold our economy together and our families and put food on our families' tables. It's been really difficult because I've been thinking about this same thing. I don't have the data or the background you do, but it just seems obvious. I was a waiter for, longer than I'd like to admit as I tried to get my career rolling in my early years. And I'm telling you, I lived hand to mouth. If I missed 1 week, I was in trouble. If I missed 2 weeks, it was game over. We are desperate. I'm gathering change to buy a slice of pizza to get through the day. Do we know how many Americans are in that type of position and probably right now are in dire straits as we speak?
Yes, so we have good data on that. The U.S. Federal Reserve does a study every year. It's called the Report on the Economic Well-Being of U.S. Households. Last year, in their survey, they found that 39% of Americans would have trouble covering an unexpected expense of $400. That's because they live paycheck to paycheck. They don't have more than $400 in reserve. So 39% of Americans would have trouble covering an unexpected expense of $400. Well, this is much worse than that, right? So ABC News, Washington Post just did a poll that came out today, said 51% of Americans have already had their work hours or their pay cut by the shutdown. And so there are profound health consequences of all of this. Goldman Sachs did a survey that came out yesterday, and they said it was a survey of 1,500 small businesses, and they found that 51% of small businesses in America will fail if the economy is locked down for 90 days. So when we see this modeling coming out of Imperial College London that somehow assumes that we can just turn off the economy for 18 months, it's bad modeling. It's bad modeling because all they've done is looked at the virus. They haven't looked at how we should respond as a society to the virus, and they haven't looked at deaths of despair and what happens when poverty goes up, when people run out of food, when people don't have money to cover their rent. Like, this is catastrophic. And when people try to have this conversation in the mainstream media, they get shouted down as
so
if
you're greedy.
all they care
You're being
about
greedy.
Yeah, as if all they care about is the stock market. No, I care about the 39% of Americans who can't cover an unexpected expense of $400.
Right.
That's the crisis.